morning, ma'am. I am your student nurse for today. May I ask your name, please?
Beverly,
This assessment is for to know what the deviation in your health and for the further assessment of the doctor. Okay. Assume that I have performed the hand hygiene and assembled the equipment. Also, close the doors for the privacy of the client. I will now inspect your head. Inspect. There are no signs of infections or some infestation, so I have no need to wear gloves. It is now to palpate the head in the TMD. We'll now go to the inspection of your neck. Then may I ask you to sip some water and then swallow. May I ask you to please bow down. And I see the cervical 7. Okay, then please put your head in your left side. Touch your ear with your shoulder. Then on the other side, right side. And then touch your chin with your chest. Then lean up, chin up. Is there any signs of tenderness you feel?
no.
Okay. I will now inspect and palpate the other parts of your neck. I will have some permission to touch your neck. Then I will palpate your lymph nodes. There are no signs of lesions or tenderness and lumps in your thyroid glands and lymph nodes, so I have no need to auscultate. May I ask this to cover with your left eye? Left eye. I will cover mine. Please focus on the object at the back of me. We will focus on our peripheral vision. If you can see this while you're looking at the other side. Can you still see
Yes.
this one?
No.
Oh,
Yes. Yes.
see.
Yes. Yes.
Just to cover your right eye. And just focus on the pen. And there. May I ask to remove the orb. Then at the other side. Then remove the may I ask you to please close your eyes? Okay, thank you. I don't see any signs of lesions or infection, so I have no need to wear gloves. And I have permission to touch you. May you please look down, ma'am? And look up. I'll palpate. Just look out straight. I thank you. We're now going to inspect your ear. Anderson. I have to palpate. Okay. I'll cover your ears and I'll whisper and say what if I have said. J, K. Can you repeat what I have said?
I didn't hear it. Again.
J, K,
TJM?
May I ask you to stand up now? Then close your eyes. Mas balance yourself. Okay, thank you, ma'am. You may sit down. I will now inspect your mouth and the inside, so I have to wear gloves. Yes. Ayun. Sige. I will now inspect the inside of your mouth. Can you put your tongue on the left side? The right? Okay. Okay. Now your tonsils. Can you put your tongue outside? I will now see the ceiling of your mouth. Can you please say ah? I'm going to inspect your nose. There is no signs of infections or lesions, so I have no need to wear gloves. Can you breathe in the other side? Same. I will know the insides. Okay. I'll now palpate your sinuses. Percuss. And that's all for the assessment. Thank you for your cooperation. The findings will only be seen by us, but our healthcare providers. Thank you. Here are the findings and result in the assessment of Mrs. Reyes. Her head is size of shape is vary, especially in accordance with his body structure. Also, it is symmetric, round, erect, and the midline, and appropriately related to the body size, like I said. And she has a oval shaped face. Here are the findings and result in the assessment of Mrs. Reyes. Her head is size of shape is vary, especially in accordance with his body structure. Also, it is symmetric, round, erect, and the midline, and appropriately related to the body size, like I said. And she has a oval shaped face. There is no signs of abnormal movements. Her head is normally hard, smooth, and without visible lesions. The temporal artery is elastic and no signs of tenderness. And his temporomandibular joint is not swelling, no tenderness or crepitation. Her neck is symmetric with the head and no bulging masses and no signs of lesion. Thyroid and cricoid cartilage move symmetric when the client swallowed. Her cervical number C7 is palpable and also visible. Of motion is smooth and controlled, no signs of tenderness in every turning. There's no palpable lymph nodes in her neck, and also no signs of tenderness. No equipment for the test distant visual and test near visual, so I have skipped the procedure. Peripheral vision, she also saw the pen. I have pointed her in every direction, in the 6 directions. Corneal light, when I reflect, it has the same light, the same at the spot where the left and also the right have the same spot of light reflecting. In the cover test of her eye, her both left and her right eye, when are uncovered, is still fixed and focused on that on the background where I instructed her to focus on, while the covered eye in left and the right also have no signs of deviation. It has no movement when the cover is removed. Also, I have conducted at the same time the position test while I'm having the peripheral vision. There's no signs of deviation. Eye movement is smooth and symmetric to all 6 directions. It's the same with the peripheral view. Eyelids is normally distributed, also has no signs of lesions and swellness in both left and right. It's symmetrically aligned and no signs of sinking of the eyeballs when the eyes is open or nor closed. Conjunctiva is clear, moist, and smooth underlines with the sclera's color is color white. Pupil constricts when the light is put and expands when the light is removed. The pupil is equal, round, and reactive to light accommodation. I have skipped the Weber's adherence test because I have no equipment of the tuning fork. In the oracle and mustard process, there is no signs of lesions and also no palpable lumps and also no tenderness. In the whisper test, there is kind of some deviation. I conducted two phrases to said, which is I have said 6 different letters where she did not hear about 4 words of the 6 letters. In the Romberg's test, I have conducted 15 seconds while she was standing and her eyes closed. In the 15 seconds, her balance was normal, but she have those swaying motions while she was standing. In her mouth, his lips was moist and ruddy pink. Also, his teeth and gums is complete with the 32 sets. No fillings or cavities. Her gums has no signs of lesions. Buccal mucosa also has no signs of lesions. Her tongue is smooth and have some small visible cracks in it, but not entirely. Only small parts of the tongue. Also, the force of the tongue is able to lift up the tongue depressor. There is no odor of the mouth, and when I assess the uvula is only +1 and +1 with the tonsils not sticking with the uvula. With the nose, there is no palpable lumps or no tenderness. In the airflow of the nostrils, there is no blockage in both left and the right side. Also, when I put the light in her nose inside, there is no signs of infections and the color is pink and also it's moist. and some presence of cilia. In terms of the sinuses, there is no palpable lumps and lesions, and also there is no tenderness.